everyone, I hope you're doing well. My name is Kapil Arora and you are watching 21.1 Running Mistakes. Today I will be talking about running injuries, followed by a guest session where you will get expert advice to cope with these running injuries. If you haven't watched the previous episodes yet, you can watch it now. So let's begin without any further ado. Shin splints. One of the most common injury for runners is shin splints. Now to throw more light on this subject, let me call upon my good friend, a physiotherapist and a sports scientist, Dr. Nikhil Late. Hi Nikhil.
Hi Kapil, thanks for inviting me to 21.1 Running Mistakes. The most common injury that I've seen in runners is shin splints, and this happens because of overload as well as overuse of the structures on the inner aspect of your tibia. Now these structures usually are the tibialis posterior muscle, and if your vitamin D levels are low, then it can also affect your tibial bone itself. Affection to the bone, which causes swelling inside the bone, which we also call as stress reaction to the bone, which can ultimately lead to a stress fracture, is not as common. It happens in a very minority number of cases, but by far the most common issue that I have seen is posterior shin splints, which affects the tibialis posterior muscle. Now the tibialis posterior muscle actually goes on the inner aspect of your ankle and finishes right at the arch, and it is responsible for holding or supporting the arch and the shape of the foot. So whenever you run, whenever there is load on the foot, the muscle gets pulled, and as long as things are okay, as in you're fine, you're running within your own comfort zone, you're running to a plan, you're not overdoing it, you're listening to the body, taking care of warm-ups, taking care of cool-downs, taking care of recovery sessions, doing your stretching, doing your strengthening, everything is fine with the world. But if for some reason you start pushing yourself, or you ignore recovery, or you ignore proper nutrition, or proper stretching, strengthening, or proper warm-ups and cool-downs, this muscle starts getting tired, because pretty much with every single step it is pulling, it is working. So eventually, after a few months of abuse, this muscle sorts of starts giving up, and you end up with a lot of shin pain. It doesn't have to take a few months. If you've been, well, let's just say pig-headed and pushed yourself too hard, it can happen within a matter of couple of days as well. But usually in most cases I've seen this is a repeated load injury, and it takes a few months before the tibialis posterior muscle starts hurting really badly. It shows pain on the inner side of the tibia, goes all the way down next to the ankle, right up to the arch and below the foot. So that's how the pain propagates, and when this muscle doesn't work properly, it gives rise to other issues as well. But the commonest injury is to the tibialis posterior muscle or posterior shin splints.
So another very common injury which runners face is kneecap injury. Can you explain us a bit more about this problem?
Now the other more common injury that I have seen among runners is injuries around the knee joint. So it doesn't necessarily have to be the main knee joint. It could be just the kneecap, the swelling underneath the kneecap because of overload. It could also be the small tendon that goes from the kneecap to the tibia, and it could also happen on the outside of the knee joint where the IT band is located. So those are the three main areas that you find injuries around the knee. Swelling underneath the kneecap or at the patellar tendon is usually because of loading. So your knee joint does the majority of work when it comes to braking. So if you're running downhill, or if you're doing shuttles where you have to stop and turn, or if you're running too fast, then in all those cases what happens is that your knee joint gets overloaded, there's swelling underneath the kneecap, and there is pain on the patellar tendon. Now the IT band issues are slightly different. They are because other muscles are not doing their job, usually because of a weak core and hips, or sometimes because the foot is not landing correctly. So the weight falls on the IT band, and the IT band and the muscles there tend to overwork, and you end up with injuries on that area, which also shows itself around the knee joint. So that is the second most common issue that I have seen among runners, and this becomes more evident towards when runners actually start building up towards the race, when they are say 1 month away or 1.5 months away, when the running speed increases, or they are putting in their longest runs or doing hills, and that's when you find that the knee issues come to the forefront. So yeah, not a great timing to get your knee injured, but that's how it works.
Thank you, Nikhil. And now the third very common injury is plantar fasciitis. Now tell us something more about this very common injury. I had it myself, and many of the runner friends, they have it all the time. Now tell us something more about this particular injury, plantar fasciitis.
Now another question that I usually get asked or people come up with is plantar fascia issues, where you have pain right at the bottom of your foot from the heel, sometimes going all the way up to your toes, but usually located right underneath the heel. Now the plantar fascia is something that ideally shouldn't be loaded so much. Okay, so if your muscles like your tibialis posterior, your calf, if they are doing their job, then the main bulk of shock absorption when your foot lands on the ground is done by the muscles. But if the muscles are not doing their job for whatever reason, the load then falls on the plantar fascia. So normally you have an arch like this, it is being held up by the tibialis posterior and the calf from behind. Now if these two muscles are not working, then the plantar fascia needs to hold the arch by working like a bowstring. And because of that, over a period of time, the plantar fascia is a very strong structure. It takes a lot of load over a lot of time, but in a few months time the plantar fascia becomes painful and sore because it gets swollen, and usually plantar fascia issues are a consequence of other issues and not an issue in itself. So plantar fasciitis is a symptom, not a cause. The symptom of muscles not doing their job. Ideally all the shock absorption should be done by muscles. It shouldn't fall on any fascia or any ligament. So if you are getting plantar fascia pain, pretty sure either your inner calf or your tibialis posterior will also be sore. Pretty sure that you might have other issues like low protein intake or low vitamin D levels or something similar, and that causes an overload on the plantar fascia and leads to a lot of pain.
Thank you so much, Nikhil. That was so nice, and thank you so much. So friends, this is the last episode of 21.1 Running Mistakes. Now let me briefly restate these main points. You can try barefoot running. You can improve your lung capacity by doing pranayama and swimming. Make proper arms movements while running. Pick up the right shoes and be hydrated. I hope you enjoyed this series. Do share it with others. Thank you and goodbye.